Bleach-free whitening is the next generation in chair-side whitening. Step 1 is a unique formulated polish paste that prepares the surface. Step 2 is a pigmented crystal finish. And Step 3 is a gloss that is a natural final coating that prolongs the life of the whitener. Contraindications for this product include teeth with cavities, poor periodontal health that may lead to bleeding during the procedure. Teeth with plaque or calculus will need to have prophylactic treatment prior to placement. Teeth with restorations, although bonding may be an exception. Removable appliances may need to be replaced or adjusted. Another area of concern is crowding in the dentition. These are the more difficult cases because it's hard to manipulate around these teeth. For your first case, it's not recommended. For patients seeking to whiten their lowers to match their lumineers, an exact match will not occur. It's recommended to brief your patient of their expectations prior to placement.
Hi, I'm Dr. Cyrus Tamasebi. I'm the VP of Clinical Development here at Denmat. It's a fantastic product. It will give you consistent, predictable results that are beautiful without any sensitivity and harmful rays. And I'm excited because Ruth is back and we can get started with her whitening treatment. We start by giving Ruth protective eyewear. Ruth, go ahead and wear these glasses. Next, I will apply the lip moisturizer. This will keep her lips moist and act as a protective barrier. Make sure as you apply this that you don't get it on any of the teeth. Now place the cheek retractor, and with the retractor in place, I like to tuck a 2x2 gauze rolled up into the vestibule to isolate the lips from the teeth. Now simply follow the steps as described in your kit. Start with a syringe labeled Step 1 Polish. Add some of this to the dampen dish. Now using the brush, apply to the teeth. The polish is a unique formulation that not only profies the teeth to remove the surface debris, but prepares the surface as well. Now once the polish has been applied to all the teeth you're whitening, you can also, where necessary, use floss to maneuver in between the embrasures. Be gentle as to not cause bleeding. Allow 20 seconds to lapse, use a prophy brush, and do a prophy run. Then give it a good rinse. Once you've rinsed the teeth for a good minute, we isolate them again. Once dry, you can see a nice frosty texture that the paste leaves behind. After prophy, you apply a very thin layer of Tenure NB. Mix equal parts of Tenure NB in a dampen dish. Use your brush and apply the light coat, which is easily absorbed by the teeth. Apply again until you get a nice shiny surface returning to these teeth. Next, we apply a thin layer of Tenure S along the teeth for the extra bond strength. Now we're ready to apply the whitener. Working the surface, one tooth at a time, place a very thin layer working around the tooth to reach all the surfaces. Then use air from the three-way air syringe to work the material around the margins and into the interproximal areas. Next, come back and manipulate the material. The nice thing about this material is that it's self-leveling. Just apply a little amount at a time and the streaks disappear with your brush. Try to keep it thinner on the incisal tips as much as you can, especially on the lower teeth. That is the area that could interfere with the bite if the material is too thick. And you also want to avoid for the material to collect in any given area. Once ready, cure for 5 seconds per tooth. Proceed to the next tooth. Again, a thin layer is applied. If there's any areas of concern, I can use my cotton swab wipe it off, and then come back to touch it up again. Because you have a varying degree of thickness, it can cause variance in its opacity. As much as you can, try to control the thickness so it doesn't gather at the gingival portion of the teeth. If you find this is happening, adjust the patient back more and have them move their chin for you. As you can see, I'm not spending too much time on each tooth. The thinner the material and the less I manipulate it, the better the results. As the material thickens, the whiter it gets. But as it thickens, it also becomes more opaque. You have to have a certain degree of control, not to make it too thick. Continue with all other teeth in the same manner. There are some clinicians who prefer different brushes. Some dentists have even used a plastic explorer to move the material around. It becomes a personal preference as to how you use this product. What you need to bear in mind is to make sure the material follows the shape and the form of the teeth, and to be thin enough in application so that you can see the actual tooth structure through it. As I mentioned earlier, areas of concern is crowding where teeth overlap. Those become the more difficult cases because it's hard to manipulate around these teeth. With areas of overlap, you may need to go back and make sure the contacts are open with a Sericel, one tooth at a time. Now that the material has been applied and cured, we go on to our final step. The gloss gives it a final clear coat that is both a protective layer and one that gives it vitality. You need to apply a thin layer and apply it evenly. Once I've applied it in a quick application, I go back and see that it's evened out. Then I cure it for 3 seconds per tooth. Now that we're done with applying the gloss, I use a 12 fluted burr to make sure the margins are clear. If you need to remove or start over, you can use a soft flex disc. Bleach-free whitening can last up to 6 months. Over time, the gloss will wear off like natural enamel. It has the potential to come off, or the product can chip over time.
If you have any additional technique questions, please call your technical representative at 1-800-445-0345.